basically the last, I don't know, 8 years or so. It works, and it works exceptionally well. This is very similar to a German process called orthokine or regenokine, where you're producing large amounts of interleukin-1 antagonists. The other interesting thing about photoactivation, I don't think it was mentioned in the other lecture, increases exosome production. Now, this photoactivation is really hitting my white cells in particular, making them go anti-inflammatory. This is what I use. A little cheap light, about $3,000, $2,000. I mean, that's not cheap, but in the overall scheme of things, treating patients, yeah, it works out very well because I can make a PRP and the patient doesn't hurt. So, DC stimulation. We got a brace here. We have silver fibers here, silver fibers here. We have a little micro generator, so to speak. A AAA battery runs it. You'll have a current, and that will increase stem cell motility to the area, increases growth factors, increases other microcirculation and things like that. So, very important thing to do. Now, what else do we use? Well, this is going to be a little surprise to everyone. Hyperbaric oxygen. It's nothing to do with the oxygen to the cells, okay? What it has is basically the research that was done by Dr. Tom at the University of Pennsylvania. Mobilization is thought to be by a nitric oxide dependent mechanism. Nitric oxide is a very potent stimulus of the bone marrow. The bone marrow will increase the amount of cells, especially hematopoietic stem cells, in the circulation by 8-fold over 20 treatments. Remember, you have a diabetic who has a wound that's not healing. Oxygen's not going to make it heal. Thus, what did I say in that second slide? Cells heal the patient, and that's what goes on here. You're getting more stem cells, you're getting higher numbers, that's what's going to get the patient better. Nitric oxide, this is one of the holy grails of stem cell therapy. My good friend Dr. Lasso will probably talk more about this in the next lecture. So important. Now, I'm going to give you another little pearl. You can find things that have, I can't really mention products per se, but look for products that have beet derivatives. That's going to dramatically increase nitric oxide production, okay? So just to let you know. Extracorporeal shockwave therapy, very important thing. This is like a little jackhammer. We were using this years ago for plantar fasciitis and tennis elbow was working great, then the insurance wouldn't pay for it anymore. But what does it do? Well, basically, it really helps stimulate stem cells to go to the area. It causes a little microtrauma to the area. Here we see some of the scientific research backing this up. Again, nitric oxide is released, vascular endothelial growth factor, neovascularization. So important things, all from a shock wave. Okay, so we do that very much. So the biological effects are right there. And I tell you, we use this, and when we have somebody who's a stubborn case, they're not quite getting better, this works, and it works well. There's a couple of different companies out there that make these. Go online and look it up. You can always ask me, and I can give you my 2 cents as to what may work best. Something that I stumbled on, being an orthopedic surgeon and a regenerative medicine physician, something called joint lavage, arthro lavage, I call it. Now, we knew that arthroscopy would work on a lot of these people with osteoarthritis for a little bit of time, and then they would get right back to where they were. So I said, if I could wash these joints out with some normal saline, I'll give you that clue, and then I put certain growth factors in it to disable the growth factors that are underneath, it might work good. This is the one thing, this is one thing